Okay, so tell me a little bit about yourself and how you got involved in the disability community.
So, my name is Shannon Swiger. I'm Director of Internal Communications at Novant Health. And I became involved with the disability community about 5 or 6 years ago. And it really was, I was pregnant with my first child and went in for some just kind of routine tests, the anatomy scan. And, anyways, through a long series of events, found out that my daughter has some disabilities. And so that was something I learned before she was born. And it was something that she was born early and has really played into our journey as being her mom and has really bringed me to learn a lot about the disability community and about her particular disability. She has a genetic syndrome that's called 22q11 deletion syndrome. She's missing a small part of her 22nd chromosome, and it really can affect everything in the body, and it's different in everyone. And that's one of the biggest things I've learned about the community is just how broad and diverse it is, even within, one particular, syndrome, for example.
hmm
So that was really how my journey started in this space.
hmm Thanks for explaining that to me because I had no idea what that meant. hmm
Yes, it is a bit of a technical term, and, it's also known as DeGeorge syndrome, but like so many rare diseases, there are so many, but it's, in fact, not rare to have a rare disease. I think, it's 1 in 10 people maybe have a rare disease, but, they have so many different names that, there are a lot of different identities that can go with it.
hmm My next question is that you worked for a disability business resource group. What was that all about?
That's a great question. So in my day job at Novant Health, I'm in charge of public relations and marketing for our physician group. But we also have the opportunity to participate in what are called business resource groups, and at other organizations, they're called employee resource groups. And really, what that is, it's a group of employees who participate on a voluntary basis, and you can join a group if you identify with that group. For example, we have a veterans group, we have a women group, lots of different kind of dimensions of diversity it can be based on. And then we also have a disability group. And so, right around the time that my daughter had been diagnosed and we were really going through some things with her medical treatments and things, I wanted to seek out some community support, maybe find people who were going through similar things themselves or with their children. And so that's how I reached out and joined the Persons with Disabilities Business Resource Group at Novant Health. And then I ended up becoming leader of that group for 3 years and have just recently stepped down, but I'm still very active in the group. But really, it's a place for people to come together who they themselves have a disability, or maybe they're a caregiver for someone with a disability, or maybe just based on their job role. It's just something that they have an interest in. For example, one of my colleagues, she was the co leader of the group. Her background is in architecture and design, and certainly accessibility of the built environment. That's something that's really important and that plays a role in her profession. So that was why she got involved. Another colleague was involved because she worked in the digital space. And how do we make our websites and our applications accessible from a digital accessibility standpoint? So everybody kind of brings these different backgrounds and experiences together to make it a better experience for the people who work there who have a disability, but also for our community members and patients. And that was really the lens that I brought to it because I saw how many doctor's appointments we were going to, and we're using the healthcare system a lot. And that helped me see some of the things that went well, and maybe sometimes when it didn't go so well. And honestly, there were opportunities. And so that's where we would really come together as a group to share our insights and experiences with our leaders to help advocate for making changes, or recognizing times when we need to bring in the voice of the community. For example, we stood up a group that is kind of like our business resource group, which is internal to the organization, but we set up a group that's of community members and patients and family members. It's an advisory council. It's called our Community Voice Disability Advisory Council because we really need to, we've heard the mantra, know the mantra, nothing for us without us, nothing about us without us. And that's really what that group tries to embody is making sure when decisions are being made that you have the voice of people with disabilities at the table, people with lived experiences, they themselves or their family.
Mm-hmm. My next question is, what made you want to go into the healthcare realm? Like, was that like a calling that you had? Did you have any family members who were in the healthcare realm? What was going on there?
Great question. I did. So I have several family members that are in healthcare. I guess it probably started with my grandfather. He was actually a bit of a pioneer in open heart surgery. He was the first open heart surgeon in the state of West Virginia, and he used to ride around on his motorcycle and cover the whole state. That was what he did. And I have aunts and uncles who are nurses and physicians. And when I started, when I was in college, I was taking all the science classes and it was something I was really interested in. But my skill set and passion has really always been around writing. And so that's where I found myself falling into this space of healthcare communications. And it's why I really love what I do because I get to tell the story of all these people who are really touching the lives of patients in so many different ways and have such a profound impact. And it's also something where there's always something new to learn about. And so I get bored really easily. So it's really been something that has catered to my interests in that way. And then, of course, it has taken on an even deepened meaning now that I am kind of navigating the healthcare system and using it like never before. My experience and my work really played a role in helping me be a better advocate for my daughter and for the disability community more broadly than that. And my husband, he's also a physician. He's an adult cardiologist. So kind of through all those different experiences, that's how I found myself in healthcare.
Mm-hmm. What are some of the stakeholders that you partner with closely? I know I know I know that on the communication side of things, there is something in the healthcare realm, so I'm wondering if you could explain that a little bit.
Sure. So there are so many different stakeholders. So in my role in internal communications, I'm primarily partnering with the people who are taking care of patients. So our nurses, our physicians, our therapists, and also the people who are interacting, maybe the person who's answering the phone at your doctor's office. So many different people who interact with our patients. So that's really my primary job is to help make sure that they have the news and information that they need to do their job. And so part of that in my work with our business resource group has been making sure that there's a better understanding of how to care for people with disabilities and what accommodations they may need. And so I'm actually working on a project right now where we're designing some education for our team members so that they have a better understanding of the do's and don'ts and can make it a more inclusive experience for our patients and really try to address some of those pain points. And so that's one thing I'm working on right now in partnership with a group that's called Disability in North Carolina. They're a nonprofit. They're a chapter of the larger National Disability in organization, which is really one of the primary partners with the business community from a disability inclusion standpoint. And so I serve on their board, but they also do a lot of work directly with Novant Health. So that's just one example. I guess another example that comes to mind are we have something that's called the Communication Aid Toolkit, or CATS for short. But they're kits that we try to have in all of our clinics and hospitals so that if a patient comes in who maybe is blind or low vision, deaf, hard of hearing, nonverbal, that there are some different tools in that kit to help improve communication with the care team. For example, we have amplifiers, we have some communication boards, we have magnets. So if you're walking into a patient's room and they speak ASL, you're not going in there and not speaking in their language. You're working with an interpreter. So those are just kind of a few examples, but I primarily work internally. But I have partners that I work with on our public relations or social media teams who are speaking to kind of a broader audience. They're more the ones who are speaking directly to our patients or consumers. And community members at large.
Mm-hmm. My next question is, what impact does your work in internal communication have on the greater community, the disability community?
Well, I guess my biggest hope is helping the disability community have a voice and helping bring attention and awareness to those lived experiences and expertise of the disability community. I think there are so many misconceptions, and not only misconceptions, but just honestly a hesitation to really even talk about it or to know how to go about talking about disability, or asking questions like, how can I accommodate your needs? And so that's where I really see kind of myself having a foot in that world. I myself do not have a disability, but learning from others in the community and from my experiences with my daughter who's 5, and hopefully someday, I want her to be a self advocate and out there and advocating for herself. Um, but that's really my greatest hope. So increasing awareness, bringing attention to the voices of people with disabilities, and also, I guess, like some best practices in the corporate world. Since I work for a large corporation, specifically in healthcare, I'm always looking for, what are some of those best practices, or those some of those things that organizations have really gotten right, and how can we spread some of those best practices so that we aren't reinventing the wheel or trying to take a guess at something without having input from the community. So that's where that community voice council, that disability community voice council really comes in and plays a role that I mentioned earlier. It's also where the business resource group comes in. And because I've been at the organization for a long time, and I myself am a leader at Novant Health, and then I was a leader of the business resource group, really had an opportunity to advocate on behalf of the group to say, hey, here's what we're hearing. Here's a survey of what our members had to say. What do we do with this? Here's what we recommend. And so that's been really positive, I would say, in terms of getting action based on sharing that feedback. We also participate in something called the Disability Equality Index, which is really this national benchmarking tool from Disability In that businesses can use, primarily large businesses, but you can use it to say, hey, are we following the best practices, or do we need to do things like, for example, focus on making our website more accessible? If I've heard some statistics like that only 2% of the internet is truly accessible, like things like that. And you're like, okay, well, we have to do better. So I think participating in things like that and sharing your experience about things like that is a way to hopefully make it spread, because we don't want it to be a secret, right? This is something everybody can benefit from and needs to know about.
Mm-hmm. Lastly, what lessons have you learned from this particular type of career in internal communications? How can communications in the healthcare realm, lead to greater outcomes and be that catalyst for change?
Yeah, absolutely. That's the $1 million question, right? Is how do we make and see that change? And I do think following best practices and kind of accountability with tools like the Disability Equality Index are important, because I think it shows like, hey, we as an organization care about this and we are investing in doing these things. So so that's not necessarily just internal communications, but it does offer accountability. But I guess in terms of internal communications, what I would say is really tapping into the power of telling stories, just like you're doing through this podcast, right? Sharing stories and experiences, I think can really bring some normalization and help people feel more comfortable talking about disability. And so that's something that we've really tried to be intentional about. We try to share stories about some of our team members who have disabilities or maybe who are caregivers of people with disabilities. And the more I talk about it and share my own personal story about my daughter and some of the challenges she faces, and also some of the her resilience and some of the amazing things she's overcome, the more that I hear, oh, my daughter has autism or my son has, um, a disability. And so you kind of create these connections and bring it out from, I mean, this isn't something that should be hidden or in the dark. Something to, I mean, nobody should be feeling shame. Creating that safe space where people can really authentically, I think, be themselves, bring their full selves to work. That's really one of the number one intentions, I would say, around what we've done. And then, to take that a step further is like once you have that comfortable space, trying to bring more people into the space, like trying to hire more people with disabilities, and telling their stories, and then really making sure that the experience from a customer service standpoint that we're delivering to people is inclusive and is meeting their needs. I think is really tremendously important and needed, and something that we're still honestly learning about. But I think the more that you can talk about it and acknowledge where you're at on that journey and at least have the conversation, that's the only way to move forward. So, really, the power of telling stories. And I've done that on social media with my own daughter, and through, I guess, one of the advocacy groups that comes to mind with her community is called the 22Q Family Foundation. So they are always on Facebook sharing stories and pictures and celebrating in the wins and supporting each other through the difficult times. And so I think there's real power in that, especially when it is something that's rare, because nobody should really go through it alone.
Mm-hmm. Yeah, that's important. All right.